In February 2022, Victoria became the third jurisdiction in Australia, after New South Wales and the Northern Territory, to decriminalise sex work. The Sex Work Decriminalisation Act introduced occupational health and safety protections for sex work. This means sex workers cannot be discriminated against based on what they do for work. The law change comes after decades of specific and cohesive regulations of sex workers. It recognises sex work as a legitimate business to be regulated like all other industries in Victoria through standard business laws. Sex workers often face unique health challenges and barriers to accessing healthcare. As a GP, understanding the specific needs and experiences of sex workers is essential to providing comprehensive and non-judgmental care. So what has changed? As of May 2022, there's no more mandatory testing for sex workers. Also, it's no longer an offence for sex workers to work if they have a sexually transmitted infection or a blood-borne viral infection. And it's no longer an offence for sex workers and their clients to engage in sex work without a condom. So why has the law changed? Evidence suggests that sex workers in Australia are actually quite knowledgeable about sexual health. They have low rates of blood-borne viral infections and STIs compared to the general population. They also consistently practice safer sex at work, like using condoms. Plus, they play an important role in educating other sex workers and community members about safer sex practices. Additionally, seeking healthcare as a legal requirement can deter sex workers from engaging with sexual health services, especially for those who already belong to marginalised communities. Evidence also suggests that mandatory STI checks for sex workers often result in low positive notifications and can put unnecessary strain on healthcare services. While these sex work-specific obligations may have seemed protective, the strong sexual health practices among sex workers meant that enforcing these laws caused more harm than good. In addition, it is important to remember that all people, including sex workers, have a legal responsibility to reduce infectious diseases and their risks. Therefore, applying specific laws for sex workers is duplication and stigmatization. Sex workers fall under the same regulations and have the same responsibilities as all other Victorians and are simply no longer being singled out. Good morning, Sarah. How are you today?
Hi, Dr. Melanie. Honestly, I've been struggling a lot lately. My anxiety has gotten really bad and I'm having trouble sleeping at night.
Oh, I'm so sorry to hear that, Sarah. Tell me, what has been challenging you?
It's a lot. I've been dealing with some personal issues and it's just been overwhelming.
Has it affected your work at all?
It has. It's affected my sleeping, my studies, my ability to work. I'm just exhausted.
Okay, tell me, what type of work do you do?
I'm a sex worker.
Oh, I actually noticed that it hasn't been recorded here. Shall I do that now?
I'm not sure. I've had some weird comments from healthcare workers in the past, and so I just prefer to be the one to tell people.
If the patient does mention getting tested or the occupation as a sex worker comes up, here are some useful tools to keep in mind for respectful practice. First, always engage in person-centered care. This means treating the patient with dignity and compassion, respecting their decision to engage in sex work, and remain focused on the patient's reason for attending the appointment. It is also important to provide clear information. Ask questions to ensure you understand the patient's preferences and respect their decisions. Next, it's okay to identify gaps in knowledge between you and the patient. Where a gap in knowledge relates to a person's lived experience rather than a medical issue, the best approach in most situations is to acknowledge it and ask whether the person would be comfortable explaining. Next, always use respectful language. Like everyone else, sex workers come from diverse backgrounds. The best way to understand any individual is simply ask what language they find the most respectful. Generally, the terms sex work and sex worker are considered respectful, as they recognize that sex work is a legitimate occupation. The term prostitute and terms that do not acknowledge the agency of the individual, such as person involved in the sex trade, are considered disrespectful. Next, you should always explain the reasons behind sensitive questions. Many sex workers have faced severe stigma in healthcare settings and may not understand why you're asking about condom use, genitals, partners, drug use, or other personal details. Clarify these questions and their purposes at the start of the consultation. If a patient corrects you, thank them and move on quickly without over-apologizing. This helps them feel comfortable when speaking up and ensures they feel safe discussing other issues in the future. Next, always respect individual boundaries. There's no one way to get it right for everyone. Individual sex workers will have different levels of comfort when discussing their sexual histories, their work, their bodies, and their medical and other concerns. Simply ask if they are okay discussing a certain topic. It is important not to assume someone works in the sex industry just because of their sexual history. If they want to talk about it, let them bring it up. Try to use their words for their body and experiences, and let them know they don't have to give specific details for testing. Next, use the opportunity to connect the patient with community and peer organizations. Peer support and community connection are critical to a person's health and well-being. While some sex workers have strong community connections already, ensure that all patients are aware of organizations that can support them in Victoria. This is a key role you can play as a practitioner. Community support may also be relevant for patients living with a blood-borne viral infection or who have already been diagnosed with one. Next, you should reassure the patient that their medical records are private and confidential. In a society where stigma can affect people's lives, handling the disclosure of sensitive identities and experiences is very complex. As a GP, you can respect this complexity by making sure conversations are private, assuring patients of confidentiality, and explaining clearly how we handle their health records. It is also important to only ask for relevant information and never include or share sensitive details without permission, whether in clinical notes, referrals, or casual conversations with colleagues. Specifically, someone's experience in sex work should never be documented or shared without their explicit consent, even if they openly discuss it. I'm really disappointed that you've had that experience, but look, please be rest assured that you don't need to let us know what work you do, and it won't be recorded if you don't want us to. Also, on the pathology slips and medical certificates, there'll be no indication that you do sex work. If I do record it though, other health professionals may have access to that. So what would you like me to do?
Look, thanks for explaining that. It has made me feel a bit more reassured that my information is private, but I think I'll choose not to record it this time.
Look, that's okay, and I completely understand that as well. Trust between healthcare workers and patients is essential for effective communication. A patient's previous experiences of stigma can undermine their trust in individual healthcare and the entire healthcare system. Trust can also be undermined by knowing that a sex worker has also had negative experiences in the past. Research shows that stigma and discrimination place a heavy burden on the mental health of sex workers. Many worry that mental health care professionals might see their work as a problem and treat them unfairly, leading to a fear of victimization. As GPs, we are often the first point of contact when patients need mental health support. This makes it crucial for us to provide the right care and support from the very beginning. The experience that sex workers have with us can greatly influence their initial interactions with mental health services. So it's vital that we approach these consultations without bias or prejudice to ensure they feel safe and supported. The Victorian Department of Health recommends that GPs should determine with their patients which conditions to test for and when. It is important that these discussions do not begin from a place of occupational stigma or any assumptions. If a patient does ask for an STI test, here are the steps to follow. First, confirm their immune status for hepatitis A and hepatitis B. You can do this by checking their vaccination history or performing serological tests. If they are not immune, recommend vaccinations. Next, if the hepatitis C antibody test is positive, perform a PCR test to determine if they have a current infection. Additionally, you should ask about any genital symptoms, safer sex practices, any incidents of broken or slipped condoms, and any sexual contact outside of work. The Australian STI management guidelines have a section specific to sex workers. This was developed in consultation with the Scarlet Alliance, the National Peak Sex Worker Association. The guidelines also contain detailed information related to standard asymptomatic checkups and sexual history taking. If the patient does test positive to any STIs or blood-borne viral infections, contact tracing is an important step clinicians must undertake. First, introduce the reasons for contact tracing to the patient. For example, you can say, "It's great that you got tested and treated, as most people with STIs actually don't have symptoms." Without knowing, people can pass it on to other partners or have long-term health problems. That's why it's important your partner or partners get tested and treated to avoid getting the infection again. Then, you will need to help identify partners or other contacts that need to be informed and followed up. For example, you can say, "For this STI, we need to inform all partners at risk from, say, the last 6 months." Think about your most recent partner and count back over this time. Use cues like location or events and avoid judgmental language. Remember, some sex workers may not have contact details for their clients due to the discreet or anonymous nature of their services. Next, explain the methods of notifying contacts and offer them some choice. For example, you can say, "From what you've told me, there are a few people who need to be informed. There are ways we can do this without them identifying you. How would it be best to contact them?" If the patient needs help with contact tracing, as a GP, you can obtain the consent of the patient to inform the patient's sexual partner. This contact tracing can be performed anonymously. If your patient chooses to inform their own partner, discuss with the patient how their partner can be informed, and then provide the patient with information to give to their partner or partners. Check out the Better to Know website for Aboriginal and Torres Strait Islander individuals, the Drama Down Under website for men who have sex with men, and the Let Them Know website for anonymous notification for all individuals. A certificate of attendance or a sexual health check certificate may be requested by the patient. At the patient's request, their working name may be used. This document is simply to certify that the patient attended a clinic for a sexual health check. It should not include any information on examination findings or results unless the patient explicitly asks for it.